My name is Diane. About 3 years ago, I started experiencing symptoms of overactive bladder, or OAB. And after seeing my doctor, I was diagnosed with OAB. My OAB was disruptive. I'd go to the restroom quite often and hardly anything would come out. But then after this urgent, gotta go feeling, I'd leak without even realizing it.
I'm Dr. Ashley Tapscott, Urovant spokesperson and a urologist. I specialize in OAB and am here to share that Diane is not alone. Overactive bladder is a medical condition that is more common than you think. OAB symptoms impact an estimated 33 million Americans, both men and women. OAB can disrupt daily activities, including travel. And that's why I've teamed up with Urovant Sciences to help raise awareness of the impact of OAB on travel and to talk about some potential options for managing symptoms during this travel season. OAB is a common condition in which the bladder muscle involuntarily contracts, creating a feeling of a sudden urge to urinate that is often difficult to control.
I was getting up in the middle of the night to go to the bathroom, and if I didn't make it in time, I'd be sneaking to change underwear and not wake my husband.
Diane's story is similar to so many of my patients. Patients also experience a sudden need to urinate that is difficult to control and frequency of urination, 8 or more times in a day. Many people with symptoms of OAB often delay seeking help from their doctors. This is because they are embarrassed or mistakenly think the condition is a normal part of aging.
I spent so many years living with that gotta go feeling, and I knew I needed help.
In a survey of women diagnosed with OAB, many waited an average of 3 years after noticing symptoms to have a discussion with their doctor. That may have been 3 years spent just coping when they may have had other options. Other symptoms can include urge urinary incontinence, meaning you experience a sudden urge to urinate and leak involuntarily. And the frequent urge to urinate, usually 8 or more times in 24 hours, making you feel like you are always running to the restroom.
I thought this was happening because I was getting older, and it was just something I had to accept.
Many patients like Diane think OAB is just a part of getting older, but OAB is not necessarily a normal part of aging. In fact, both men and women of all ages can experience symptoms of OAB, and there are effective ways to manage OAB symptoms. Patients can make several lifestyle changes, such as dietary adjustments and bladder training. Many doctors recommend pelvic floor exercises or Kegels that may help postpone the emptying of the bladder, and also using disposable or washable incontinence underwear for longer trips. These are all possible options of managing OAB. As we prepare for Bladder Health Awareness Month in November and the busy holiday travel season, it's the perfect time to educate and spread awareness about OAB. Many who have OAB may avoid long road trips and plane rides or experience anxiety about visiting cities where they don't know where they will find a bathroom.
I used to hold back on booking trips because I was afraid of leaking or not being able to find a bathroom.
People cancel trips to holiday gatherings, family celebrations, activities with friends, and more because of their OAB symptoms, such as the urge to go to the bathroom more often or having an uncontrollable bladder.
I love to travel, and I don't want my OAB symptoms to make me feel uncomfortable about traveling.
You should always talk to your doctor or healthcare provider to determine what is right for you. There are several effective ways to help manage OAB symptoms. I like to recommend Gemtesa to my patients. Gemtesa is a prescription medication approved by the FDA for the treatment of OAB in adults with symptoms of leakage episodes, urgency, and frequency. Gemtesa is designed to help relax your bladder muscle so it can hold more urine, reducing the need to run to the restroom and the number of leakages you may experience. In clinical trials, significant reductions were seen in urgency, frequency, and leakage episodes or urge urinary incontinence at 12 weeks for patients taking Gemtesa versus a sugar pill. Do not take this medication if you have a known allergic reaction to Gemtesa or any of its ingredients. Tell your doctor right away if you are unable to empty your bladder or have a weak urine stream. Tell your doctor if you are taking medicines that contain digoxin or have liver or kidney problems. Side effects may include headache, common cold symptoms, diarrhea, nausea, urinary tract, and upper respiratory tract infection. For more information and tips on traveling with OAB, please visit time2go.com.